I came from Bosnia a long time ago. Inspiration to working in the health system
Good, you're good.
made me when I was young.
Okay, so I've balanced work and home life. I'm actually still struggling with that, but I just learned to not do so much overtime and not be so quick to pick up shifts just for extra money and to spend more time at home with the kids on the day that I'm actually really off.
Most
I'm a patient ambassador at Mercy South Hospital, so I deliver all the food trays to the patient rooms and I bring the clean linens from the tug up to the nursing unit and I put it in the closets.
That's pretty good. It's actually pretty good B-roll to show.
Hi, I work in the dish room and I'm the lead and I help make sure everything's cleaned correctly and runs smoothly.
Go.
Hi, my name is Mackenzie Moon. I am a current student at the University of Missouri studying occupational therapy. I currently work at a nursing home in St. Louis called Friendship Village where I serve food for the residents there. I love working in healthcare because I like knowing that I'm making people's day better, even though I'm not directly working for or something that's going to help them better. That's what I'm working towards, and working in healthcare now as a food service worker makes me able to do that before I get into coming from a nurse who currently works in the healthcare system. I pursued nursing because I love learning about the human body and the way it works and wanted to make a difference in people's lives. I had a very sick cousin when I was young and saw how much a good nurse made in her day, and I felt like I could do the same. The challenges in my job depends on the day. Biggest thing I've learned is in healthcare, you see people at their worst. The challenges in my job depend on the day. Biggest things I've learned in healthcare is you see people at their worst, so when they're challenging to work with, I need to treat them with kindness. Another big challenge is shortage of staff. I have had to learn to be okay to leave some things undone because I have to do the important tasks first, and I can't always get everything I would like to get done completed. Work-life balance is something we work on every day. My husband and parents take care of dinners and kids on my work days, so I get to go home and focus on the kiddos and nighttime routines. I'm fortunate to have a schedule that allows me to work 3 days a week and have the other days at home to do what needs to be done at home and get to raise and hang with my kids.
My name is Fred Moon, and I'm a retired nursing home administrator. I worked in that profession for over 55 years, and my job was to see that the residents were cared for and the staff was taken care of properly. You treat people right and they'll treat you right. And the daily routine was getting to work, seeing how many staff people were there, see if we had to adjust. I worked very closely with the director of nursing, and she was a great lady. And we'd both see how the staff was doing, how the residents were doing, see that they got their meals. I would take inquiries from hospitals that wanted to admit patients, and then we'd go visit the patient, and maybe sometimes the family would come and see us. And we were very cooperative with each other, and I was very impressed with most of the people that I worked with. I was very impressed with the hospitals, the people I worked with. And they were impressed with us because they knew we took care of the patients right. And that's the main thing. And sometimes they would go home and they'd need home health services. And my former late wife was a nurse, an RN, and she did home health services. And she was very, very good at what she did. She was very intense, in depth, and very concerned about families and the residents.